Take a look at this ECG. What diagnosis would you make for this patient? This is a completely normal ECG, but you might have been confused by certain elements such as the downsloping over here and the jagged lines you see here. The downsloping is what we call baseline wonder, and it is due to poor electrode contact with the skin when setting up the ECG. On the other hand, these jagged lines are due to skeletal muscle interferences. There are a number of other issues that can happen when setting up the ECG. On the other hand, let's see this ECG strip. What diagnosis would you make now? This is also a completely normal ECG strip. You have every element such as equally spaced QRS intervals, a P wave, and even a T wave. But sometimes you might notice a small flattened wave called the U wave right after the T wave. The U wave actually is rarely seen, but when it is, it can be due to numerous things actually. It can be due to hyperkalemia, hypercalcemia, digitalis, and the thing is that even if they are there, we don't consider an ECG abnormal. In fact, they're so low in amplitude that you will always see them go unnoticed. And the most likely place to find them would be in the right-sided precordial leads.